Hey guys, Woodruff here, and today we're going to go over some complex cardiovascular disorders practice questions. So there's so much in the cardiovascular section. I've created a video for general cardiac disorders for complex, and then I have one for hemodynamics, one for shock, and then one for EKG, because those are all very big topics. So hopefully these will help you to start breaking down some of these. Keep in mind, I do not teach in this class. And so, if your professors ever come back and say she's wrong, then they are correct. I always default to them and their expertise. And if you ever find something that's wrong, you're always welcome to bring it to me. I would love to improve what I'm doing. So I cannot include a question about every single disorder. And remember, part of this is to learn about test taking strategy, and part of it is to kind of look a little bit at content, but hopefully one way or another, this is helpful to you. So question one. A nurse is assessing a client with blunt chest trauma. The client has muffled heart sounds, distended neck veins, and a blood pressure of 75/45 milligrams of mercury and heart rate of 130 beats per minute. What should the nurse do first? So first, I always like to process the question, be like, okay, so what is this question really asking me? And so I got to look at some of the key information. So someone's had a blunt chest trauma, and now they're showing signs of a problem. And in complex, when you're reading a problem like this, a lot of times we're trying to discern, okay, is this expected? Because sometimes in complex, like some of these patients, they seem really sick, but they're actually okay. So I need to determine, is this like a serious thing, or am I like, do I do an assessment first, or what am I going to do? Well, I don't even see any options to assess a patient, but sometimes some of these questions might be like, hey, is this something serious, or do I just watch it? It looks like they have muffled heart sounds. That doesn't sound good. Distended neck veins, that's signs of fluid overload, and really low blood pressure and a really high heart rate. That just does not sound good. So what it's asking me to do, and this is something that might be different than what you did in previous semesters, is it's not telling me what the problem is. It's expecting you to identify what is the problem, and not only what is the problem, but what is your priority action. Oh, so scary. So many things to do, but this is what life is as an ICU nurse. So let's look at our options here. So my first option is start client on a norepinephrine drip. Oh God, they just had to throw medications in there, didn't they? And this is me that wrote this question. So I did this to myself. One choice, and if you know what norepinephrine is that helps to increase your blood pressure. Well, that sounds great. Their blood pressure's low. It sounds like something I might do, but I don't know if it's the first thing that I want to do. Because anytime it says, what are you going to do first? You want to think, what is going to be the action that I take that's going to have the biggest effect, their most direct effect, or be most helpful to get to the bottom of the problem. And so I do need to do that, but I don't know if that's going to actually solve this problem. The next one says draw blood for a troponin level. Well, they had a blunt chest trauma. They could have issues with having a heart attack or having heart damage. It's probably going to be elevated, but it seems like they're going through a crisis right now. It doesn't seem like a time to draw blood. So I'm going to cross that one out for now. A lot of times drawing blood is usually not the right answer. Not always. Don't come back later and say, Ms. Woodruff, you said it's never the right answer. It's not usually the right answer, but it can be sometimes. So, like a lot of times it's going to delay care to draw blood because there's not a lot that I can see in it. Like most of the time in situations in complex, we want to emergently take action versus like assess and do other things. But anyway, we might do that later, but it doesn't seem like what I want to do right now. Prep client for a pericardiocentesis. Oh, that's a big word. So that sounds like we're going to be removing fluid from their heart, I would assume, since it's a pericardial. That sounds like maybe that's helpful. If this was like cardiac tamponade, is it? What do you call it? We'll get back there. I'm going to keep that one on the back burner. And then D is administer metoprolol intravenous push. So, their heart rate's elevated. That seems like it would help. I definitely want that heart rate down, but this kind of looks also like answer A, where it's something I want to do, but I don't know if it's going to necessarily just cover up the symptoms or actually help with the problem. And that's the thing here. Another test taking strategy you can look at here is both A and D are medications that are going to help fix my vital signs, but are they going to fix my problem? And that's what you have to think about. What's the actual problem here? And if you know what's going on here, these all are the hallmark signs of a cardiac tamponade. The muffled heart sounds, distended neck veins, that low blood pressure, high heart rate are all those hallmark signs of cardiac tamponade. And the only way to fix cardiac tamponade is to relieve the pressure from the fluid accumulation around the heart with a pericardiocentesis. So C is the best answer here because it's going to get to the bottom of the problem. It's the most direct. And now after, if they still have a low blood pressure or high heart rate, maybe later I might need to do this. But yes, and the other thing to consider with D is if I give this metoprolol and their blood pressure is already low, this is going to lower it even more. It's probably not safe for them. But anyway, that's just a side note there, just to kind of remind you about how beautiful beta blockers are. So correct answer here is C. Question 2. A nurse is caring for a client with disseminated intravascular coagulation. Don't you just love complex with these fancy terms? DIC, as a result of septic shock. What is the priority intervention for the nurse to complete? So a patient's in DIC and it's telling me why they're in DIC too. They had septic shock. So it's saying, what is the priority intervention for the nurse to complete? So priority intervention means what do I need to do first or what is most important? So it's saying that maybe I need to do all these things, but which one is going to have the best effect, the most direct effect, or is going to be most helpful for this client? So let's see. Connect client to an ECG monitor and monitor potassium levels. Well, their potassium levels may be off. I always, you think in your head, you're like, potassium, that's really serious, life or death. I got to do something about it. It's kind of serious, but I don't know if it's as directly related to shock as other things would be. So I'm going to put it on the back burner. Administer packed red blood cells through a rapid transfuser. Well, I know with DIC that they clot and they have bleeding. And I think that we want to give packed red blood cells, but I don't know about through a rapid transfuser. And I don't know if it's the first thing I want to do, because I think I remember reading that we want to give blood, but we give it just to replace what's missing. We don't want to give too much because they're just losing more and more. So I'll keep that on the back burner too. So let's see, fluid resuscitation, antibiotic therapy, and vasopressor therapy. Well, that sounds like therapies to treat sepsis or septic shock. So, I mean, that sounds good. And if I remember correctly, the only way to fix DIC is to fix the problem that caused it. So I like that answer the best so far. We'll get back there. Let's see, give intravenous heparin, continuous infusion through IV pump. So this kind of goes back to this, like similar to B, like, I'm going to give some red blood cells, possibly, depending on how much bleeding they're having. And I might also give some heparin to stop them from clotting. It depends on how the high risk. So when I see two answers that are very similar, like they're equal in the sense that, with both of them, those are two things that I both might want to do. One of them can't be priority if they're both on the same level, where I might give one, I might give the other. So I can kind of cross out B and D because for a patient with DIC, they may need packed red blood cells or they may need heparin, but it's not definitive. I would need more information to know. And that's a doctor decision too at the end of the day. But, it's saying at the, when it's asking, what is the priority intervention, we're getting back kind of like the last question. What's going to be the thing that's going to get to the bottom of the problem here? And the problem here is I'm in septic shock, which has led me to be in DIC. So I can give all the blood that I want. I can give heparin. I can connect them to the ECG monitor and monitor their potassium levels, but none of this is actually going to stop the DIC. The only thing, like the heparin and the PRBCs, are just band-aids for a bigger problem. I will not stop using up my clotting factors and bleeding out until I fix the problem that led to the DIC, which is the septic shock. So the best answer here, even though I know you're probably sitting there and saying, damn, I don't like this question, is C, that I'm going to treat the sepsis by fluid resuscitation, antibiotics, and vasopressors. Love you guys. All right, question 3. A nurse is giving discharge education to a client with infective endocarditis. Which statement by the client indicates that further teaching is needed? So discharge education. So this patient's getting ready to go home. So we're thinking like they're in a less acute period. You should always think about, okay, is there something happening right now, or where are we at in our stay? And so it says, which statement by the client indicates further teaching is needed? So it's always really important with these questions to look at, is it asking for what's right or what's wrong? And this is asking for what is wrong. So we're pretty much saying, we're going to look through these and say, true or false, is this expected for infective endocarditis, or is this teaching I want to give with infective endocarditis? So the first one says, I should expect to experience joint pain and discomfort. So if I remember correctly, people with infective endocarditis can have those weird joint symptoms, and those have all the weird names and stuff like that. So I'm going to say that that's true. So I don't think that this is the correct answer for this. It says, I will need to know how to accurately take my temperature. Well, it's an infection, and I would think if they're going home, they probably want to know if the infection's getting worse or not getting better. So that seems like something good to do, to know how to take their temperature. All right, I may be unable to tolerate activities and need to be on bed rest. Well, I know with a lot of the stuff with the heart that it's hard to breathe and do activities at the same time, because it, like, if you have an infection in your heart, then I would think that it would increase the workload of your heart. It would make it harder to do things. I like that one, but let me see what the last answer is. What do you call them? I will need a PICC line and to be on antibiotics for at least a year. So I know that they need to be on long-term antibiotics, but I don't remember how long. So like, let's say I get down to this one, I'm between C and D, because, I like with these, both of these are answers where both parts have to be correct. So maybe I may be unable to tolerate activities, but maybe I'm like, but do they need to be on bed rest? A lot of people might get stuck there. And maybe I will need a PICC line, but I don't know if it's supposed to be for at least a year. I don't know how long they're supposed to be on antibiotics. So maybe what if I'm stuck here? Then I have to sit there and go back to the question, and it's saying like, okay, they've got infective endocarditis. What is showing that they need further teaching? So a lot of times with these, I'll look for what sounds more extreme or like seems like, man, like that's going to be like that seems like it's very what's the word I'm trying to look for here? It's going to be what is going to be very like too intense, like, or too like black and white versus what do you call it? A lot of times there's so much gray in nursing. So a lot of times I look for an answer that's a little bit more flexible or less severe or less serious. And so what do you call it? Answer C is a little bit more flexible. It says, I may be, it doesn't say I will be, I may be unable to tolerate activities and need to be on bed rest. It doesn't say I will definitely, but it's just saying, hey, there's this possibility there. Where D says, I will need a PICC line and to be on antibiotics for at least a year. And I feel like they're on antibiotics, but I don't know if they're on antibiotics for that long. So I'm going to go with answer D, and that's because I know it's the right answer, that it is wrong. So people with infective endocarditis are on antibiotics for months, but not usually a year or longer. They're not going to need to be on antibiotics for the rest of their life. So usually it's a period of weeks to months versus a year. All the rest of these answer choices are correct and true for infective endocarditis. So question 4. A nurse is assessing a client who just returned from an abdominal aortic aneurysm repair, which finding would require immediate intervention. So this is, it's really important here to look at time. It says they just returned. Anytime it's talking about a patient with surgery, you always want to know where, when they got back, or like where we are in their recovery process. And so it's saying like they just returned, so they're immediately post-operative. Which we're finding would require immediately intervention. It should say immediate intervention. So it's saying which of these is most scary effectively, or which one of these, if I don't intervene right now, serious consequences could occur. So my first choice is urine output 15 mils for the past hour. Well, I don't like that at all. I know when they have that AAA repair, we're worried about like clots or blockages and other things to their legs and to their kidneys. So I don't like that. That's kind of already ding, ding, ding in my head, like that might be the right answer, but let's keep going. Client reports abdominal pain 5 out of 10. So this question's asking me pretty much what's expected immediately post-operatively and which is a sign of a problem. I'm going to expect that they're going to have some abdominal pain. They just got their abdomen cut into in order to fix this aneurysm. So I would expect them to have some pain. Hypoactive bowel sounds in all quadrants. Now I know I don't want absent, but hypoactive, especially after surgery, that's to be expected. So I'm okay with that. Client is drowsy and open eyes to sound. So, I mean, they just returned from surgery, so they've had anesthesia, other things. So it's going to be normal for them to be drowsy. I definitely don't want them to be drowsy long-term or have a decrease in level of consciousness long-term. But the only one that actually sounds really scary to me is that decrease in urine output, because I'm going to be worried about them occluding off of their arteries that are going to their kidneys. So if they have decreased urine output, that can be an early sign, like a sign that their kidneys are not getting perfusion and things that they need. So I'll need to report that immediately. So A is the correct answer that is the most scary. Let's try again. There we go. So a nurse is providing discharge education for a client recovering from a mechanical valve replacement. Which statement indicates education was effective? So someone's going home, they've had a mechanical valve replacement. So which is showing, and then this is the opposite, that it was effective. So I want to look for which one of these is correct. So it means 3 of these are wrong, 1 of these is right. And this is really helpful to know because this is like a true false. So think of it like a true false in your head. So A, I will need to have this mechanical valve replaced regularly. I don't think regularly is a good way to look at it. The mechanical valves last longer than the biological ones. I don't think you need it replaced regularly. So I don't like that. False. I will need to take anticoagulation for at least 1 year. Well, I like the first part of that. I like that I will need to take anticoagulation. And this is where a lot of students get caught up is they read the first part of the statement, but they don't read the whole thing and they get stuck and they're like, yeah, I definitely want to be, I need to take anticoagulation, but it's going to be for longer than for a year. They need to take anticoagulation for the rest of their life as long as they have that mechanical valve. I will need to let my doctor know when I have dental work planned. Well, I know there's a lot of stuff around teeth and heart health. And so I like that one. That's the one I like the best so far. So that's the only one that seems at least semi-true to me. Let's see. D is I will need to be on immunosuppressants to prevent rejection. This is a mechanical valve, not a biological one. And even the biological ones, they're not, I don't even think you need immunosuppressants for them either. So I'm going to say that the correct answer here is C, which is correct. After having a mechanical valve, the patient's going to need to be on anticoagulation for the rest of their life. They do not have to have it replaced regularly. They do last for many years. They may at some point need a replacement, but with the mechanicals, they last a lot longer. They do not need to take immunosuppressants because it's a metal piece. It's not some sort of tissue or other things. And even with the tissue or biologic valve, the way that they create those, you do not need to be on immunosuppressants. It's not like receiving an organ. But we do need to let our doctor know when we're going to have dental work plan because we may need to do prophylactic antibiotics with these patients because they're going to be at high risk for getting infections as a result of that dental work. All right, number 6. A nurse is evaluating a client for possible rheumatic fever. Which question is most helpful for the nurse to ask this client? So this kind of question, what we're looking at here is this is like I'm doing a history and physical or something with a patient. It's asking me what's going to be most helpful to ask, like which question is going to give me the most information, and not just in general, but to assess if they have rheumatic fever. So in other words, this is like a risk factor question, looking to see who has how do I assess someone's risk factors for rheumatic fever? The other way this question could be asked is it could ask a question like, which of these assessment findings is most indicative of this? Or it could tell me it could give me statements that the patient says, like if the patient says, which of these statements is most connected to blah, 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 and it might be something about their history. So there's a couple different ways we can ask this, but this is asking me, what question do I need to ask that patient? Does anyone in your family have a history of heart disease? Well, I mean, they could have a history of heart disease, but I wouldn't say that's because it says most helpful, which means multiple of these may be helpful, but what's going to be the most helpful? And I think asking them about heart disease in general, I mean, they could have heart disease, but that's not going to put them at risk for necessarily rheumatic fever. I'm going to say no to that one. When was the last time you had a dental checkup? Now, I know there's all those ties between, dental health and heart disease, but I don't think regular dental checkups prevent rheumatic fever because it has to do with that throat infection. So I'm going to say maybe, but I don't like it. Ooh, I like this one. Have you had an upper respiratory or throat infection recently? I like that one because if you remember anything about rheumatic fever, it's all about that streptococcus infection. So that's the one I like the best so far. And then D is, are you experiencing any chest pain or shortness of breath? So this is a really good distractor. This is a good distractor because it focuses on symptoms. And this is where students get distracted because they're like, oh, I think those are symptoms of this. This is not asking, these are very general symptoms. So I can't, like, you have to ask yourself for each of these questions, if I ask this question alone, would it be enough to help me to see that they have a high chance of having rheumatic fever? And having chest pain and shortness of breath, that could be angina, that could be CAD, that could be a lot of different things. There's a lot of lung conditions it could be too. It's what is the most specific question? And the only one that is very specific, that just from it alone, I could say they probably have a good chance of having rheumatic fever, is going to be C, which is, have you had an upper respiratory or throat infection recently? Hopefully that helps to kind of break down, but this is how you need to look at these questions, is when you're looking at them, you really have to think about that strategy. Okay, like what is this really telling me? And so when you're with a question like this, you don't usually want to choose the one that has symptoms in it, especially if there's only one that has symptoms. If they all have symptoms in them, then one of them has to be right. But what I mean is that it's not asking you, with this one, like the symptoms are not specific enough in order to differentiate this. Now, if we were talking about a different disease that had very specific symptoms, like, for example, going back to like adult, if I was sitting there and being like, hey, do you have ulnar drift or Boutonniere's deformity? That's very specific to rheumatoid arthritis. Or do you have the nodes if you have osteoarthritis, et cetera? That's very specific, but these are really general symptoms. So I cannot look at these symptoms and get the best information possible. Hopefully that makes sense. All right. Number 7, a nurse is caring for a client post-coronary artery bypass graft or CABG. Which interventions should the nurse include in the client's plan of care? Select all that apply, your favorite. So select all that applies. I always take these as true, false, all the way down. Do not play games, just true, false, going straight down, make my choice, move on to the next one. No going back or saying, ooh, there's only 2. Shouldn't there be at least 3? And, playing all those mind games. So I am caring for a client after the coronary artery bypass. It's just saying, what am I going to include? All right, cool. So it doesn't tell me when they had it, but it just says, what am I going to do after? So let's see. A, give pain medicine prior to ambulation to help with pain. Well, that sounds good, because I know this patient, they literally cut their chest open. So they're probably going to be hurting a lot. So they're probably going to walk and move around better if their pain is treated. So I'm going to say yes for A. And I'm moving on. B, teach clients to use arms to get out of bed in balance when walking. Ooh, I don't know about that, because since their chest was cut, I don't think that they can use their arms the same way. I don't think we want them pushing or pulling. So I don't like that one, because I don't think we want them to use their arms. So I'm going to say no, and I'm moving on. Encourage client to splint when they are coughing to minimize pain. Now that's good. Put the pillow on the chest and help them. So that's going to that's going to help with their pain. It's also probably going to help them to take deeper breaths. Okay. All right. Yeah, that's good. All right. So I like that. So I'm going to go say yes and move on. Keep the client on strict bed rest until chest tubes are removed. Well, that's one of those that you have to sit there and be like, is it safe to get them out of bed? And even though this patient's going to have a lot of wires and tubes, I think we really want to get them up and get them moving. It's so important to get them moving. So I'm going to say that that is false. The last one, monitor the client's ECG for any rhythm change or ST segment changes. Well, I like that. That's very general. And that's also, very helpful, because this patient just had a surgery to help to alleviate blockages in their heart. So I'm going to say that that's important. So I'm going to go with A, C, and E, and I am correct. Woohoo! So hopefully you got it right with me too. We don't want them to do any pushing or pulling. It can pull at their chest incision. It can actually cause them to rip open their sutures, and it can lead them to needing like rib plating. It's very painful. And then they do not need to be on strict bed rest. They can get up. We just have to be very careful with those chest tubes and all their lines. We get multiple people in there and get them up and get them moving. Because if we wait until after their chest tubes are removed, they can end up having very serious postoperative complications. So yes. All right. Last but not least, the nurse just finished a report on the following clients. Which client should the nurse see first? A client with restrictive cardiomyopathy who is reporting a new shortness of breath. Oh, hold on a sec. I got so excited. I didn't even go over the question. Here, let me go. The nurse just recently reported on the following clients. Who should the nurse see first? So this kind of question is saying, here's 4 patients. They all might have things going on. but which one do you need to see first? And most of the time, these questions, what they're going to have is they're going to have patients that have stuff going on, but you have to know, hey, is that normal for that patient? Like, for example, a patient with heart failure may be short of breath, or may have a patient with COPD might have a lower oxygen saturation, things like that. So you have to think about this patient. Is this what's expected for this patient or not? So effectively, you always want to, when you are reading these, you want to say like, okay, well, that sounds not good, but is this okay for this patient? So starting with the first one, a client with restrictive cardiomyopathy who is reporting a new shortness of breath. Now here, I'll give you a little clue here, is that anytime there's something new, different, sudden, acute, unexpected, we usually don't like it. Usually it's a sign that like there's something, anything that's new or different, I need to go and evaluate that usually first. So this is already the top of my list for probably my first patient, but let's keep going. A client who just returned from cardiac cath 4 hours ago and is having occasional PVCs. So if it said frequent PVCs, I'd be super worried, because that means that they could go into VTAC or ventricular tachycardia, but they're saying having occasional. And so I know sometimes that after you have a cardiac cath, and especially if you had a stent put in or something, your heart's waking back up, you can start having a little bit of fluttering in the heart or PVCs. So I'm going to say that's okay. A client with pericarditis who is due for their morning dose of antibiotics. Okay, well, I definitely want to get them their morning dose of antibiotics, and those do need to be timely, but it doesn't sound like they need me right now, because this is the other thing you want to think about. Which patient, if I don't go to them, could lead them to death the quickest? Then a client with an aortic aneurysm who's scheduled for surgery in 2 hours. Here's another thing. A lot of times students will choose this one because they're like, oh, I got to get in there. I got to get them taken care of. But here's the thing. We'll get to them and we'll get them in for their surgery when they need to. But at the end of the day, which of these patients needs me right now? The only one who's having something new, different, unexpected is going to be A, the client with restrictive cardiomyopathy, new shortness of breath. So I definitely want to go in, check out that patient, and see what is going on. Anyway, those are the end of these questions. There will be more to come for complex cardiac stuff. I hope this was helpful. And I will leave you with my favorite words, which is, I love cardiac, and I hope you do too. Hopefully you're falling in love with it as much as I do every time I teach it. I'll see you next time.